Hello everyone, I'm Diksha Devkota, a medical student here from Nepal, and today in this video, we are going to talk briefly about the treatment of tuberculosis in Nepal according to the National Tuberculosis Management Guidelines 2019. So, without further ado, let's get started. The World Health Organization recommends the use of multi drug therapy for the treatment of all cases of tuberculosis, which is further standardized by the respective countries. So, why is this multi drug regimen used instead of monotherapy for the treatment of tuberculosis? Let's discuss it one by one. The first reason is that these 3 to 4 bactericidal drugs they are used to render the patient non-infectious as soon as possible by rapidly killing the dividing bacilli. Another reason is to prevent the development of drug resistance. Next reason for the use of multi-drug regimen is to prevent the relapse. Relapse means the patient remains culture negative throughout the treatment course, but again becomes culture positive after stopping the treatment. So, in order from stopping this from happening, we need to use multi-drug regimen properly. Lastly, the multi-drug therapy is used instead of monotherapy to reduce the duration of total treatment. So, these were the objectives of multi drug therapy. Now, let's talk about how this multi drug regimen is actually administered. The best way for the effective treatment is through the use of DOTS, which is directly observed treatment short course. So, here the regimen is administered to the patient in the right time with the right dose for the right duration under the supervision of the trained healthcare professionals. So, there are basically two phases in this treatment course. They are the intensive phase and the continuation phase. In the intensive phase, the patient usually receives 4 tuberculosidal drugs for a period of about 2 months. So, the main function of this phase, if this intensive phase, is to render the patient non infectious. So then comes the continuation phase, where the patient usually receives about 2 to 3 drugs, mainly isoniazid and rifampicin, for the period of 4 months, about 4 months, which may vary. The objective of this phase, of the continuation phase, is to eliminate the whatever bacilli is remaining and to prevent the relapse as well as resistance. So, what are the drugs used in the treatment course? So mainly first line drugs are used in the treatment course, which are HRZE, which means isoniazid, rifampin, pyrazinamide, and ethambutol. Now, let's talk about the actual treatment protocol of tuberculosis in Nepal according to the National Tuberculosis Management Guidelines 2019. For all types of new TB cases, including the TB cases in adults and children, and also for mild extrapulmonary cases, we use HRZE for 2 months, that is the intensive phase, and use only HR for 4 months, which is the continuation phase. For the extrapulmonary, complicated extrapulmonary cases, uh, we use the intensive phase remains the same, that is HRZE for 2 months, and for the continuation phase we add another drug, that is ethambutol. So the continuation phase usually lasts for 7 to 10 months, but if the sputum test is again positive and the treatment needs to be continued beyond 12 months, then it must be referred to higher centers. So this is the treatment for the complicated cases. Now, let's talk about the retreatment cases. For the retreatment cases, firstly, drug susceptibility testing must be done to detect the drug resistance. So, firstly, expert MTB or the rifampin resistant test is done to detect the resistance to rifampin. And then this test is followed by the LPA or line probe assay in order to detect the resistance for isoniazid. Now, after the test, if the patient is rifampin sensitive and isoniazid sensitive, then the treatment protocol remains the same. That is HRZE for 2 months in the intensive phase and only HR for the continuation phase. So this is continuation. I have written it continuous. It's the same. For If the patient is rifampin sensitive and isoniazid resistant, then we should use HRZE for 6 months along with levofloxacin for this full duration for 6 months. Levofloxacin is a fluoroquinolone antibiotic. Now, if the patient is rifampin sensitive and the status of isoniazid susceptibility or resistance is not known due to the unavailability of LPA, then we should give 6 HRZE for the full duration, that is 6 months, but we need not give levofloxacin. So this was the treatment for the new TB cases and retreatment cases for the drug susceptible TB. But if the treatment protocol for the multi-drug resistant TB and the extensively drug resistant TB is different, and we'll talk about that in the next video. So this was for today. Thank you so much for watching, and I will see you guys in another video. Thank you.